Hakeem, let me ask you a question.
Yeah.
Why are you passionate about this work?
I'm passionate about this work because when I was diagnosed with bipolar disorder in 2000, I had no clue what mania was. When I saw Jesus on the corner, when I heard Alex Trebek talking to me through the television, when I was running up and down the streets of Cambridge as a sophomore at Harvard University, I had no clue what was going on with me. And my parents had no clue. So when they brought me to the hospital in that spring of 2000 and I was diagnosed with bipolar disorder, you can imagine how scared I was, how scared they were. So I'm speaking out about my experience and my story to help others who are going through what I went through 14 years ago. So I'm sharing my story to help others.
Hakeem, how would you talk to someone with bipolar illness about the issue of relapse?
So dealing with relapse, I would say two things. One, I believe there's a huge shame associated with relapse, especially if you've told people around you that you're dealing with bipolar disorder, both mania, of course it comes with the mania and depression. What if I sink into depression? What if I go into mania? I think it's part for you to know that, and them to know that it's a chronic illness. So sometimes I may go down, I may go to the depths, and sometimes I may get a little excited, but know that I haven't failed at living with bipolar disorder. The second thing I would say is that for the person living with bipolar disorder, know that if you do relapse, you haven't failed with living with bipolar disorder. So know that it is part of living with a mental illness, that there's always a chance of relapse, but that doesn't mean that you don't know how to take care of yourself, and that doesn't mean that you don't know what to do when you get down or get too high.
Okay. Hakeem, what would you say to a high school student who was just diagnosed with bipolar illness?
What would I say that to a high school student? I would say that life is not over. There is a light at the end of the tunnel. I know that I went through what I went through at 17, 18, 19 to come back and share this 14-year journey specifically with young people just diagnosed. I speak at hospitals, psychiatric wards, I speak at alternative schools, I speak at regular schools, and I want them to see an image of somebody who went exactly through what they went through and made it out the other end. What I say is that there are thickets, there are thorns, but on the other side there'll probably be roses. So.
How would you recommend that someone masters their bipolar illness?
So I would say that it's very individual to each person. But for me, I put it into a couple of categories, and I think people can deal with it from those categories. So I say one is treatment, coping skills, acceptance, and then seeking purpose. So let me break that down. So acceptance means knowing that you have an illness and knowing that you need to seek treatment and go through healing. Treatment means getting the right medication. If you choose to use medication, I recommend medication for myself. And second part, after knowing that you're living with mental illness, is treatment. You have to seek treatment, which for me means medication, seeing a therapist, seeing a psychologist. That's what treatment looks like for me. And maybe in the past, I used to go to support groups, and I found those very helpful for me. And some people may integrate that into their lives. And coping skills means how do you find ways to positively deal with your illness? Treatment and acceptance alone is not going to sustain you. You have to be able to incorporate everything into your life, whether it be diet, whether it be exercise. I'm vegan, so I know whatever I put in my body is going to affect how I feel and how I think. exercise, lowering anxiety and depression, training your thoughts, what you think is important, what you think about yourself, how you think about the world. And spirituality for me is a huge part of coping skills, and that brings that element of perspective.
Hakeem, do you think medication has changed you?
So, do I think medication has changed me? I think there are three parts for me taking medication. One is persistence. I believe that I gained 30 pounds over the course of 3 months. When I first started taking medication, my mind slowed down. But persistence means that continuing to take it, even though even though you get some negative side effects. But courage is also part of it. So persistence and courage, meaning speaking up, learning about what the side effects are and sharing with the helping professional. So you have to be able to advocate for yourself, but you first have to learn about what the medications are and what they can potentially do on you, but also noticing. And then the other part is trial and error. So knowing that you're going to go through different combinations of medication as well as different types of medication. So I say those are three key parts around medication, and I would say that that's how you manage meds, and that doesn't necessarily change you, but you have to learn how to live with it and manage it.
Good. Okay.
What is it meant for you to run the group for DBSA support group, and what is it meant for the people in your group?
Hakeem, I found it an extraordinary experience. I've probably run at least 500 groups literally over the last 10 years. We've seen probably 10,000 patient visits, and I've seen lives changed. I see that there's something that people can provide for one another that they can't get from a therapist, no matter how good they are. And let's be practical about the fact that most therapists are not going to talk about their personal experience, and most psychiatrists are going to be involved with psychopharmacology. One unique place where people can hear stories very analogous to their own, ask questions, and where people will talk very personally is in a support group. And so I believe it's a unique aspect of healing. In fact, to be frank about it, I believe that everyone with this condition should attend a support group to supplement medication and individual therapy. And let's mention another thing, Hakeem. An awful lot of people can't afford individual therapy of any sort. And the only therapy that they can get besides medication, they're going to find in a support group. And they're going to find something quite wonderful and something quite special, something very careful. And it becomes a really caring community, which I believe is unique and something that people look forward to on a weekly basis. Awesome. And in fact, indeed, they make very dear and close friends in a group like this, which is enormously important to them as they go on this journey of ups and downs.
Sure.
Hakeem, what would you say to a parent who asks you, is my son or daughter who has this diagnosis going to have a normal life?
What would I say to a parent? I would say that, one, that your child's job right now is to get better. I would say that to both the parent and the person and the young one dealing with mental illness. sometimes we want to push that person back into school or back into work. But I think that if they know that it's okay to take this time to learn about what my symptoms are, to learn that it's okay and this time will get better, I think it's important for them to know that, one. And two, I think it's important for the loved ones and the person living with mental illness to know that you are a different you. You're not going to be the same person. You are going to learn to be in this world differently because you're different. And that's whether you have a mental illness or not. We grow, we change, we develop. So two things I would say. One, take your time. It'll give yourself the space to get better. And also know that you will, honestly, you will ultimately have different capabilities, mental illness or not.
Hakeem, what would you say to a young person who hears that he has to take medication for this condition, possibly for the rest of his life?
Sure. So when I first heard that I had to take medication and take it for the rest of my life, potentially take it for the rest of my life, I didn't know what to think. So now when I go back and share, I say that medication is, think about if you broke your arm, you need something to stabilize your arm. You're not going to just let a broken arm hang. I think it's the same way depression, deep depression, and high highs of mania with bipolar disorder are traumatic experiences or trauma. So you need something to really stabilize you. But I would also say that at some point, you can taper off and taper down off of medication. And that has really helped me coming down and figuring out the right combinations of meds, but also along with coping skills. So what I would say is that I think medication plays a role for you, young person, but also know that there'll be a time when you can find the right combination or even come off of the medication.
Hakeem, if a young person comes to you and says, how do I explain to my family what's going on? What would you tell them?
It's a tough question because it's the people closest to us that we want to love us the most and understand us. But it's also the people close to us that we don't want to bug us, you know. So I think it's different for everybody. One of the things I say that mental illness shows up different in different people. For me, I'll just answer for me. When I was diagnosed with mental illness, my parents knew that the type of person I was. They knew that I was very hardworking and persevering and pushing through. So they gave me the space to do that. They gave me the space to be like that. And I think if I was a different person, they would have to have a different approach. So I think for two parts. One, if you're living with mental illness, as a family member of a loved one with mental illness, notice how that person's personality is and they're approaching this illness. And two, how do you explain it to a family member? I would just talk about real concrete terms. To explain to a family member, talk about concrete terms. I'm feeling sad today. I didn't feel like getting out of bed today. Yesterday, I felt a little bit better and I could do this or I could do that. I feel like eating today. So what I would say to them is speak in very concrete terms.
Hakeem, were you scared of relapsing?
Yes. In the past, I would have been scared of relapsing. And I was scared of relapsing because, one, I thought people would think I'm crazy if I came out and said, hey, I have a mental illness, and then I got depressed or manic again. So the main thing was, if I relapsed and other people knew, I was really scared of that shame. But now I'm not scared of quote unquote relapsing, because I know that it's a process of getting better, and it's a constant state of recovery. So it's about managing myself, my life, and my illness. So I'm not scared of relapse now, because I know relapse is a part of living. Getting a little down is part of living. And it doesn't mean, just because I get depressed, doesn't mean that I've failed at living with bipolar disorder.
Hakeem, what's been your experience with peer support in general, and particularly with the role of DBSA?
Sure. So peer support in general, I believe, is supremely important. You have to know that somebody has been where you are, and offering somebody where they are where you've been. So that shared experience is so huge in saying, you know what, I got depressed like that 10 years ago, but I'm doing well now. So that equal experience.
What was your initial reaction to sharing your diagnosis with your friends, and did it change at any point?
So my initial reaction to sharing my diagnosis with my friends, some of my closest friends did not know for 12 years that I was diagnosed with mental illness. That was because of the shame, the anxiety, that what if I got depressed again? Would they run away from me? Would they think I was crazy? I didn't tell them because I felt shame, and I didn't feel like I owned my illness. So now I feel that I'm in a place where I have coping skills, where I have strategies, where if I feel I'm getting down, I know what to do. So I feel more comfortable talking about living with my illness, and of course in that I feel more comfortable sharing.
Hakeem, if you'll forgive me for being more personal, how has the diagnosis of bipolar illness affected personal, intimate relationships in your life?
So I believe, I would say this to a person living with bipolar disorder and a person considering dating somebody living with bipolar disorder, is that anybody who you're in a relationship with needs to take care of themselves. And I think managing your illness and knowing that you're in a constant process of recovery is taking care of yourself. So I would say if that person knows what their symptoms are, knows what their triggers are, and has coping skills, you can be in a relationship with that person. If living with mental illness and you feel that you can own your illness and feel that you are comfortable with it, I feel that you can have a successful relationship. And in fact, I've told the women that I've dated that I have bipolar disorder. And it's okay for asking that question. You are forgiven.
Hakeem, were you comfortable taking medication?
So I had this wonderful psychiatrist when I first got diagnosed with bipolar disorder 14 years ago. I walked into his office. He had mounds of papers, and between some of the papers sat his desk. He wrote out my first prescriptions and he gave it to me. I was still trembling and shaking because of the medication that I received in the hospital. I'm still adjusting to it. And as I rose up, he saw in my face that I was concerned. And I asked him, you know, how long will I take this medication? What is it going to do to me? Is it going to change who I am? The doctor says to me, he said, well, you know, I look at medication like this. So think about, you see the table there. We're in a room, you can't see the sunlight. The sunlight doesn't change what's there. Medication is like the artificial light. It doesn't change what you see, what's there. It just helps to illuminate it when you can't see the other sunlight. So think about it like that. Medication is the artificial light that helps you see who you are.
Hakeem, can you ever get off medication?
Well, I would say from this perspective, I'm on medication right now. It's been 14 years, but I've learned how to, again, manage it. And at this particular point in my life, I feel the best I've ever felt in my life. And I believe that medication helps to stabilize me in certain ways. But I don't believe it's only the medication that helps me do who I am and what I'm doing in my life, which is advocating and speaking up. So I think people can get off medication. I do want to come off medication at some point, but I know it's about being effective in the world. That's my main goal. And if medication doesn't have very many side effects and you can be effective in the world, I'm not against continuing to take medication.
Hakeem, many people are afraid that if they have this diagnosis, this becomes who they are, rather than something that's happened to them. What do you say to them?
Sure. So it took me a while, I would say about 9 years, really to get that I'm not bipolar disorder. When I was first diagnosed, I remember being in the hospital and a nurse practitioner on the ward said that, Hakeem, you're very talented. People see the hospital as a revolving door. I don't want to see you here anymore. What that said to me was that I am more than my illness. You know, I could be on a hospital ward, but I don't necessarily, that's not who I am. And another experience that I had was when in 2009, 9 years after I was diagnosed, I remember laying on my couch, it was a brown suede couch, and I was hanging, my arms were hanging off of it, and I was watching TV for like 18 hours a day, 9 years after my diagnosis, thinking I had lost the gains that I had made. But what I realized in those moments, I was still trying to improve myself. I was still watching self-help TV shows and reading self-help books. And what I realized, my mind went back to 2000, and I said, he said that I was more than this. And even now, I can see that I'm more than my illness. So what I would say is that, one, you know, flat out, you are more than your illness, and you are not your illness. You are your experiences. And I believe that to my deepest core. And I believe that as people recognize that, both people living with mental illness and their loved ones and the society, I think that will begin to crack stigma as well.
Talk a little bit about spirituality and the role that it plays in your recovery.
Sure. So a lot of faith-based communities, people in faith-based communities say that you can pray your illness away. That's a huge sentiment, I know in a lot of communities of color. But I say that mental illness, distinguishing between mental illness of the brain versus illness of the mind. And I think when we ground mental illness as an illness that is caused by chemical imbalance or can cause by trauma, we know that it's something that needs more than prayer. It needs whether talk therapy, whether medication. So that's the first thing. But I also say spirituality can be part of the process of treatment and healing and coping skills, but not the only thing. So for me, spirituality has provided perspective. It also has provided as a huge coping mechanism living with mental illness.
Hakeem, what sort of images or stereotypes did you associate with bipolar disorder, and do you associate with it now?
So for me, I know that when you hear the word bipolar disorder, you hear crazy, right? When I go into schools, generally they say, I ask them, what do you think? Words, stereotypes, and images do you associate? They say crazy, retarded, mental institution, bars, jails, straitjackets. Some of the things that I know I associate with it, and in the past used to, a homeless man mumbling on the corner, or like the movie Psycho, you see all the images of person's eyes bugging out of their heads. But now I know that's not the case. What I know the case is that 1 out of 4 adults, Americans, are living with mental illness, 1 out of 5 adolescents. And I know not everybody living with mental illness looks like that, acts like that, and mental illness is not that.
Hakeem, what would you like to say about the matter of relapse
Sure.
as it relates to bipolar illness?
Sure. What I would like to say about relapse and bipolar disorder is that we're in a constant state of recovery. I believe that wellness is the goal, but I think we always have to manage the illness and know that we are always engaged in getting better and being in a state of wellness.
Hakeem, when you first started to experience this condition, did you feel like you were going mad?
When I first experienced my manic episode, I thought it was engaging, it was fun, it was thrilling. But after the tail end of 3 weeks and when I couldn't sleep for 48 hours and I was starting to see demons and snakes and the TV was talking to me and telling me doing different things that I didn't want to do, it became very scary. So I was glad that I was hospitalized and came down off that high. But it was at one point thrilling, but then it became very scary. But I'm glad I got treatment.
Hakeem, when you first got the symptoms you talked about, did you think you were going crazy?
When I first got the symptoms, I did not know what was going on. So with mania, with bipolar disorder and mania, when I was staying up all hours of the night, writing poetry, writing some of, I believe was my best poetry at the beginning of 2000, when I thought that it was a great experience, right? But after a while, when I was about to be hospitalized and I hadn't slept for 48 hours, it was scary. So I didn't know what it was, one. So when I experienced it, I had no words to put to it. But initially it was fun. It was a great experience. It was exciting. It was thrilling. But after the tail end to 3 weeks and I couldn't actually sleep, it was scary.
Well, Hakeem, you had your first illness, you got through it. There's a relapse, you got through it. And then ultimately, perhaps there'll be another one, or there has been another one. How do you deal with that? What role does perspective play in the way you deal with a relapse, having lived with the condition over some time?
So first, it's important to know that bipolar disorder is a chronic illness. It's important for me to know that, and it's important to know that I'm in a constant phase of recovery and learning to master myself and the symptoms of the illness. So perspective means that, yes, once I get to learn that I go through cycles and moods, and sometimes I might get high or low, getting through it once is, whew, I made it through. Getting through it twice is like, okay, I'm starting to learn that I could recover from this. And getting through it 3 and 4 times starts to show you that, listen, this is something that I can master and live with and incorporate into how I live in this world.
Hakeem, what do you think a student, a high school student or a young college student should know about mental illness?
I think they should know mental illness is not the end of their lives if they experience it. I believe that they should know how to help a friend if a friend is going through it. I believe they should know that it's okay to seek treatment. It's okay to talk about it, to tell a friend, to tell a guidance counselor, to tell a teacher, to tell their parents. I think that the younger generation is going to change what it means to have a mental illness. So they need to know exactly the definitions, they need to know the symptoms, and they need to know what to do about it.
Hakeem, since this is an illness or condition that you're going to be living with for the rest of your life, how do you see the role of perspective?
Perspective is huge living with a mental illness, especially living with a mood disorder. So for me, a couple of things. One, knowing the phrase, "this too shall pass," is very helpful. Whether it be in the spiritual context or just everyday moods, knowing that, yes, I go through cycles. So knowing that things will happen and waves will come over me makes it easier to deal with because I know I haven't failed at living with a mental illness. That's a huge thing. So I think that's a large part of perspective.
To be specific, what are some of the things you do to nurture your own spirituality that might be helpful to others?
Sure. Some things that I do to nurture my own spirituality are attending church if I need that spiritual food, meditating, doing yoga, reading quotes, passages, even poems and meditating, quiet walks. I think all of that is about spirituality. How do you know that you're part of a larger ecosystem and it's not only about you? Because I think when you get into the throes of depression, your world kind of collapses onto you. But learning that there's more than this and there's more than you really helps to provide, again, perspective.